Even when you think you are alone, you are living with trillions of microorganisms in your gut that outnumber the cells in your body. The term we use for this population is our gut microbiome. There are over 1,000 varieties of bacteria in our microbiome. Some are good and some are bad. We want the good ones to outnumber the bad ones. The type of bacteria we have can impact our mood and mental health, as well as a variety of disease states. For example, diabetes, cardiovascular disease, multiple sclerosis, rheumatoid arthritis, allergies, and obesity. They can also impact surgical recovery and can be impacted by the stresses associated with surgery. Before an operation, we tend to get a little or a lot stressed. We tend to not sleep as well as normal. The surgery itself includes anesthesia, antibiotics, and unexpected complications requiring treatment, sometimes with things like blood transfusion, that can also impact our gut microbiome. After surgery, there might be even more stressors like infections, respiratory challenges, changes in hormones, and medications like opioids, antibiotics, and proton pump inhibitors that can change that microbiome. Several studies have looked at surgery, its impact on our gut bacteria, and what effects supplementing with probiotics and symbiotics can have. In general, there seems to be a relationship with lower infections, faster recovery of bowel function, and lower rates of postoperative diarrhea and abdominal cramping. There are studies that look at probiotics and decreasing chronic constipation, which seems to be promising as well. Overall, we still need more research, but at this point, taking probiotics and eating probiotic-containing foods seem to have a positive impact on recovery and does not seem to have any negative impacts. If you want to make your gut biome healthier, what should you do? Most importantly, include probiotic-containing foods in your diet. There are fermented foods like yogurt, kefir, kimchi, sauerkraut, miso, and tempeh. You can also take supplemental probiotics, but I would suggest you do that at a time farther away from surgery to get started and gradually work up on the amount, as you may have some challenges tolerating them. An important way to help keep our gut biome healthy is to feed the good bacteria and avoid feeding the bad bacteria. The good bacteria like foods that contain food ingredients called prebiotics. Good sources of prebiotics are asparagus, garlic, onions, wheat, tomatoes, honey, rye, and milk. Actually, most fruits, vegetables, and legumes contain some types of prebiotics. Polyphenols are antioxidants that feed microbes and are found in these foods. The bad bacteria tend to like sugar, so eating less sugar and sweeteners helps us to avoid feeding them. Some other ways to make our gut biome healthy are managing stress, getting regular exercise, getting adequate sleep, and avoiding antibiotics unless they are needed. Also avoiding things like disinfectant cleaning products, and then avoiding smoking. Taking good care of our gut bacteria is helpful to be able to give us a better quality of life.